Thank you very much, Dr. Karthik, and very good morning, dear friends. Indeed, it's a pleasure and an honor to launch the employment vertical of Doctors Classified. I strongly believe in real friends being family without a birth certificate. And to me, Dr. Karthik and Dr. Priya are such people. And it's a real honor to see such a great launch with so much of passion, energy, enthusiasm that you have worked and launched this today. And this is going to be of great benefit to the healthcare industry. My dear friends, I worked as a software engineer, as a vice president of a company for 4 years before I joined the healthcare industry in 2007. So when I came in, it was a surprise to me that people were not glued to technology. And more, it is word of mouth. You know, I want 3 nurses, I want 10 nurses. Can you recommend? Can you find out from some hospitals or from colleges if it's possible to get me some nurses, doctors, junior doctors particularly? So the use of technology in this industry has not been, the adaptation has not been to the extent as to what it should be. That's point one. Now coming to the second aspect, where you have a lot of platforms available. But what happens there is someone from some other industry, like IT, or a vertical like hospitality, hospital sector, put up a vertical and then expect the healthcare also to launch their needs into such verticals. So what happens is that there is a total disconnect. And I saw it in multiple occasions, having been an assessor for NABH for 13 years now, and having traveled this country far and wide, being the Secretary General of the Consortium of Accredited Healthcare Organizations, I can tell you hundreds of examples as to how other industries dictate terms and conditions to healthcare. The simplest I can tell you is about the statutory and regulatory for fire. There was an experience where in one of the meetings, the fire advisor of this country stands up and says, there was a fire incident and all doctors and nurses ran away. And my fireman saved 12 ICU patients. And thereafter, we decided that these are the norms. I went up and asked them, sir, do you think this is the ICU patient, a fireman, an untrained person? Do you think this person could have saved 12 such ICU patients, ventilated patients? How is it feasible, possible? And then they looked at the picture. I said, I don't think it's possible for him to even move one person. And then they are regulating based on what they think is appropriate for the industry. So I said, now you had a committee. How many doctors, nurses, or healthcare engineers did you have as part of your committee? None. And then, the regulation comes in with all impractical aspects of what a hospital just cannot implement. So this is the problem. This industry is isolated. So what happens is that newer things are not coming into the picture. People are not representing the case. They are not standing there to say this is what we need, or as customized as possible to the healthcare industry. And that is where I think innovations like this really plays a major role in making lives simpler, easier for particularly small and medium hospitals. I really appreciate the passion. We have had fights about small and medium level hospitals. So Dr. Karthik used to say, Madam, all this NABH regulation, all this is for large hospitals. Smaller hospitals, do you think this is going to impact at all or help at all? Certainly, yes. But then, it is a lot more of customization that is required. And I really appreciate him because what he stood that day for, I think he's really implemented today. This portal is really going to benefit the small and medium healthcare industry and also the large, even the corporates, because it's extremely important that we stay connected and not just word of mouth, call up somebody and find out, I need someone, I need a number of nurses, I need a number of technologists. But it's going to revolutionize the industry, I feel, because this is designed by a doctor who's worked as, probably he's run his own hospital, working as an administrator, being part of the Indian Medical Association, knowing all the problems. he has actually put together a beautiful platform which is going to address all those gaps that he has noticed through the years. And I think he has spent the time wisely. The 1 year of the pandemic, he's probably sat through it, thought through it, and put it neatly together. So when we look at a technology platform, there are three things that we look at. Number one, is it simple and clean? I see that in this platform. It's simple, clean, no unnecessary information needed at all. That's point number one. And I really appreciate you for that. Cluttering the website, cluttering with too much of information really does not help the users. In your case, you made it as simple as possible, decluttered the whole thing, and has kept only the basic bare necessities that the employer and the employee needs to know. Number two, and the most important aspect, is security. And I think you have thought through it well. I'm sure you would have worked on the data security as well, to a large extent, to protect cybersecurity and other aspects. So security aspect is certainly strong. And the fact that you've even looked at the incognito mode is another, I think it's an innovation, because I wouldn't want somebody to know that I'm actually applying for a job, my employer to know, and employer vice versa. So I think that's a good thing that you really thought through it from a social perspective as well. And the third and the most important aspect is the ease of use. Not multiple, clicks here, there, going from this platform to there, and the independent links coming, pop-ups coming up. All those are not here in this platform. It's very straightforward. So I personally feel this is going to revolutionize the way we think. And it's probably also going to help us the way you probably has put buy, share, rent. You may also think about putting something like sharing even resources of manpower. Sometimes you see, somebody working for only 3 hours in one hospital, RSO, working in multiple hospitals, sharing them. A lot of innovation that you can think of. Wonderful initiative, a lot of innovation. With great passion, you have started this. And with the healthcare industry in mind, as Dr. Prakash rightly alluded to, it's a social entrepreneurship that you have embarked on. The pricing is extremely, I would say, cheap. So I don't really look at it as a business venture at this point in time. It's more a helping the industry. That's how I look at it. Let me conclude by saying that only passions, great passions, can elevate the soul to great things. And that's probably what is Dr. Karthik standing for. And I wish him and this great platform success and real success in the years to come. Thank you very much for this wonderful opportunity given.
Thank you, madam.